reticulocyte index and reticulocyte production index.
The residual RNA is metabolized over the first 24 to 36 hours of the reticulocyte's lifespan in circulation. Normally, the reticulocyte count reflects the daily replacement of 0.8 to 1% of circulating red cell population. A corrected reticulocyte count provides a reliable measure of red cell production. In the initial classification of anemia, the patient's reticulocyte count is compared with the expected reticulocyte response. In general, if the erythropoietin and erythroid marrow responses to moderate anemia are intact, the red cell production rate increases to 2 to 3 times normal within 10 days following the onset of anemia. In the face of established anemia, a reticulocyte response less than 2 to 3 times normal indicates an inadequate marrow response. In order to use the reticulocyte count to estimate marrow response, two corrections are necessary.
First correction is reticulocyte index.
The first correction adjusts the reticulocyte count based on the reduced number of circulating red cells. With anemia, the percentage of reticulocytes may be increased while the absolute number is unchanged. To correct for this effect, the reticulocyte percentage is multiplied by the ratio of patient's hemoglobin or hematocrit to the expected hemoglobin or hematocrit for the age and gender of the patient.
Correction for anemia. This correction produces the corrected reticulocyte count. For example, in an adult male whose reticulocyte count is 9%, hemoglobin 7.5 grams per deciliter, hematocrit 23%, the corrected reticulocyte index is 9 into 7.5 divided by 15 equals 4.5%.
In order to convert the corrected reticulocyte count to an index of marrow production, a further correction is required, depending on whether some of the reticulocytes in circulation have been released from the marrow prematurely. For this second correction, the peripheral blood smear is examined to see if there are polychromatophilic macrocytes present. These cells, representing prematurely released reticulocytes, are referred to as shift cells, and the relationship between the degree of shift and the necessary shift correction factor is shown here. The correction is necessary because these prematurely released cells survive as reticulocytes in the circulation for more than 1 day, thereby providing a falsely high estimate of daily red cell production. If polychromasia is increased, the reticulocyte count already corrected for anemia should be divided again by 2 to account for the prolonged reticulocyte maturation time. The second correction factor varies from 1 to 3 depending upon the severity of anemia. In general, a correction of 2 is commonly used. Appropriate correction is shown. If polychromatophilic cells are not seen on the blood smear, the second correction is not required. The now doubly corrected reticulocyte count is the reticulocyte production index, and it provides an estimate of marrow production relative to normal. So correction number 2 for longer life of prematurely released reticulocytes in the blood. This correction produces the reticulocyte production index. In a person whose reticulocyte count is 9%, hemoglobin 7.5 gram percent, hematocrit 23%, the reticulocyte production index is equal to 9 into 7.5 upon 15 whole upon 2, that is equal to 2.25.
Clinical application of correction of the reticulocyte count.
In order to use the reticulocyte count as an indicator of effective red cell production, the reticulocyte percentage must be corrected based on the level of anemia and circulating lifespan of reticulocytes. Erythroid cells take 4.5 days to mature. At normal hemoglobin, reticulocytes are released to the circulation with approximately 1 day left as reticulocytes. However, with different levels of anemia, reticulocytes and even earlier erythroid cells may be released from the marrow prematurely. Most patients come to clinical attention with hematocrits in the mid-20s, and thus a correction factor of 2 is commonly used because the observed reticulocytes will live for 2 days in the circulation before losing their RNA. Premature release of reticulocytes is normally due to increased erythropoietin stimulation. However, if the integrity of bone marrow release process is lost due to tumor infiltration, fibrosis, or other disorders, The appearance of nucleated red blood cells or polychromatophilic macrocytes should still invoke a second reticulocyte correction. The shift correction should always be applied to a patient with anemia and a very high reticulocyte count to produce or provide a true index of effective red cell production. Patients with severe chronic hemolytic anemia may increase red cell production as much as 6 to 7 fold. This measure alone therefore confirms the fact that patient has appropriate erythropoietin response, a normally functioning bone marrow, and sufficient iron available to meet the demands for new red cell formation. So this table demonstrates the normal marrow response to anemia. If the reticulocyte production index is less than 2 in the face of established anemia, a defect in erythroid marrow production or maturation must be present.